start off with what is euthanasia. Euthanasia is the painless death or assisted suicide that happens when someone is suffering from a serious illness or injury. There are three types of euthanasia. The first type is voluntary euthanasia. This is when the patient gives consent for the action to be performed. The second type is non-voluntary euthanasia. This is when the patient cannot give consent for various reasons. For example, if the patient is a child or the patient is in coma. The third type of euthanasia is involuntary euthanasia. This is when the patient is forced to go through euthanasia. There have been conflicting views over the issue of euthanasia. Some people were for it and some people were against it. And we're going to discuss these arguments later in this presentation.
One of the key issues or arguments revolving around euthanasia is the professional versus personal decision and the patient's autonomous right to make decisions about their life and death. A common name heard among this topic is Philip Nitschke, a pro-euthanasia practitioner and advocate. Nitschke's opinion is based on the autonomous right of people who are tired of life to have a choice of life or death. Chow enforces Nitschke's opinion that individuals have a right to make a decision about how and when they would like to die. The point Nitschke, Stewart and Chow are trying to get across is that it is important that just like any other medical procedure, that euthanasia retains a patient-centered approach. Therefore, they are able to decide if they want to undergo the procedure once they are informed of all the details. The main case for this is that it will and can reduce the suffering of an individual if they are likely to die in the near future. To quantify the figures, the Australian Institute surveyed over 1,400 individuals. Astonishingly, greater than 70% of people agreed that euthanasia should be legalised within Australia. This increased to 85% when asked about terminally ill patients. Taking this all into account, there are many possible treatments that can be used by patients to reduce their suffering, such as counselling, meditation, physical therapy, and numerous medical treatments depending on the condition. More importantly, from an ethical standpoint, overuse and unnecessary use of euthanasia measures often see many preventable deaths occur. The Patients' Right Council exhibit the 1990 study of euthanasia in the Netherlands, which shows that 1,040 individuals were unlawfully put to sleep without consent, and an additional 8,100 individuals pass away due to doctors purposely overdosing their patients. The largest downfall of an early death is that family and friends often left hopeless in mourning. It can be particularly difficult as individuals may be willing and ready to die. However, their relatives may struggle to cope with an early departure. Although Australia is shown to be pro-euthanasia, data, history, and actions suggest that the poor monitoring and non-maleficence of individuals overrules the autonomy for a patient's right to die.
Euthanasia provides for a humane and dignified end for suffering. Much discussion still occurs due to the moral and ethical factors, which is the reason behind why euthanasia is still illegal in Australia. Reasons such as religion, abuse of power, and the idea that euthanasia is the stepping stone, the slippery slope, that once the choice to end life is legal, it will be difficult to protect life. Most religions believe in preservation of life and not ending life. Physicians' power regarding euthanasia is vital. Many fear that this could result in death of individuals not chronically ill. Patients could be manipulated or coerced into requesting assistance in hastening death. People with impaired judgment or vulnerable people may be at risk. In Australia, we expect physicians to promote our welfare under all circumstances. We do not want to lose trust between the physician and the patient, but we also do not want patients to feel abandoned in times of suffering. The ultimate question is whether we should allow someone to legally end life under medical supervision. If active euthanasia were to become part of the Australian law, the clinical implications would require that a patient must be terminally ill, suffering great pain, themselves request to be euthanized. By requiring at least 2 specialists to certify that the patient meets these 3 requirements, the law aims that neither family members nor doctors will be able to abuse the law. There would need to be discussion around equipment and medication that would be required when it can occur and the legal rights of staff, patients and families. Australians believe they have freedom and choice. Currently in Australia, citizens who do not wish to prolong their life after an accident or severe illness due to having a poor quality of life undergo processes where they sign forms with approval of their doctor to withhold of food and water. This gives the patient some choice, but the choice to suffer painfully. The Hippocratic Oath of Do No Harm is a code designed to guide doctors in what are actions. Although there are different interpretations, overall it could just as easily mean don't artificially keep someone alive when death is preferable. Laws must be put in place to have distinct boundaries to end someone's life. Decide who has the right to the decision, who makes or denies the decision, what obligations are there to inform family members or authorities versus confidentiality and privacy rights. At present, the medication given to terminally ill patients is to alleviate pain and suffering even though it may ultimately cause death to the individual. Patients may choose to not eat or drink and may sign not for resuscitation orders or antibiotic cover orders. With euthanasia, medication given to terminally ill patients will alleviate pain and suffering and cause death. It will be the choice of the patient when and where, surrounded by family and friends, or to be alone. The choice is theirs.
In conclusion, the debate on whether euthanasia should be legalized in Australia continues. However, there has been quite a few attempts in state, territory and Commonwealth Congresses to announce advertisements to authorize euthanasia. Till today, none have been effective. Euthanasia remains illegal in Australia till today. According to the state and territorial criminal law, euthanasia or aiding suicide can result in charges of murder or even manslaughter. Similarly, the World Medical Association corporates also believe that euthanasia should be unlawful, as it clashes with the fundamental ethical principles of the health field, and they encourage all physicians to desist from performing euthanasia. Hence, the disputes on whether euthanasia should be legalized in Australia remain unresolved, and physicians are still arguing about this issue until today.